Hello everyone, my name is Aakanksh Gurnani, and welcome to my YouTube channel Neuro Chat with AG. On this channel, I plan to cover topics that are closest to my heart and support the neurodiverse community. Topics related to neurodiversity, autism spectrum disorder, and more. On the channel, I will interview thought leaders, esteemed researchers, scientists, professors, doctors, and psychologists, seeking their views and updates on their latest work, research, etc. I will also chat with parents of neurodiverse kids and adults and talk about experiences of neurodiverse individuals. My guest today, Dr. Harry Voulgarakis, is a licensed and nationally registered health service psychologist who is board certified in behavior analysis at the doctoral level. Specializing in behavioral analysis, neuropsychology, and health psychology, he focuses on evaluating and treating individuals with autism and other complex neurogenetic conditions from infancy through adulthood. Dr. Voulgarakis serves as an assistant professor of child study at St. Joseph's University, New York, and as an adjunct assistant professor at Teachers College, Columbia University. He was recently named a Distinguished Fellow of the New York State Psychological Association, where he also serves as an executive board member of the Forensic Division and is the lead instructor for the National Board of Forensic Evaluators. His involvement in research, policy, and teaching is marked by his positions as an editorial board member for the Clinical Neuropsychologist and a reviewer for children's healthcare. Dr. Voulgarakis' contributions to the field are also recognized through his publications in various outlets, and presentations at national and international research conferences. Dr. Voulgarakis, welcome and thank you very much for the time today.
Hey, thank you so much for having me. I'm excited to be here.
And to kind of jump right into it, can you please share what initially inspired you to specialize in research and clinical practice related to autism?
Sure. Well, I initially didn't seek to specialize in research, but I did get into this pretty early. Most of my first job was working with kids. I was a camp counselor. And then from there, most jobs I had through high school and then college were working with kids. And when I graduated college, I needed a job. And so through a mutual connection, I got a job at a school, a small private school for children with, most were autistic, but a range of neurodevelopmental conditions. And from there, it very quickly became a career, a profession. But very early on, I remember being intrigued and wanting to know more. I think similar to, you had shared your story with me before you started recording. I had a very similar kind of experience where I really wanted to understand the brain, the behavior, what was going on, the body, and the related challenges, which we'll talk about in a little bit. So I went back to graduate school for education first, and then psychology after. And that's kind of the quick version of what got me here today.
Okay, yeah, thank you so much for sharing that. And what do you think some of the most significant advancements in autism research that you've observed over the past decade are?
Well, I think there's been a ton, especially because autism is still a relatively young disorder. And it is something that our understanding of is really still unfolding. And so we've done a lot in a decade and in 2 decades even. One of the biggest things I think we've seen is the research on gender, because autism for a very long time, and still very much so, is predominantly a male-dominated disorder, such that about 70% or more of individuals who are diagnosed are male. And more recently, research has shown that that might not be true, or maybe we just weren't as good at detecting it. And there is a female phenotype that is becoming more and more prevalent. So that's one of the big areas. One of the other big areas, I think, is transitioning toward a more multidimensional understanding of autism, as well as other neurodevelopmental disorders. I think for the longest time, we focused very much on behavioral markers and behavioral identification. And as we have gotten to understand various parts and how they're interrelated from the brain to the gut to all these different areas that we're seeing more research unfold. So those are just two big areas that I think I've really seen some big advancements in.
To kind of expand on that, how do you see the field of autism research and treatment evolving in the next 5 to 10 years?
Here is the neurodiversity movement, which is something that we've been hearing a lot more about, or at least using the term. It's something that's been around for quite a while. But the idea that autism is not necessarily a disorder that requires treatment, but a neurotype, a presentation of humans that maybe sometimes requires us to be a little bit more understanding, all the while acknowledging that a very large subset of individuals with autism do require some kind of treatment because of language limitations and so forth. And so I think what we're starting to see is more precision-based medicine, more human-focused, more holistic medicine around autism and treatment and research. So being able to really look at the whole person. And as well as, I think, like I said, these other areas we've already talked about, continuing to advance our understanding of how autism might present. In lesser known presentations, minorities, underrepresented groups, for example, autism, as I said, for the longest time was a male-dominated disorder. We also saw it much less in racial minorities. And so we've seen some research around why that is. Is it really less prevalent in racial minorities, or is it an access to care issue? And the research is leaned toward the latter in a lot of respects. And so I think we're going to continue to see a lot of research across different areas, from identification to various ranges of integrative treatment.
Thank you. And could you also talk about the difference between child psychology and pediatric psychology and how that relates to your research in autism and genetic disorders?
Yeah, definitely. It's a great question, and it's one that I think confuses people from time to time. Child psychology is really, I think, what most people think of it as. It is psychology and clinical psychology in most respects applied to children. So things like anxiety, behavior problems, maybe school refusal, any range of clinical mental health problems that might arise in children. And usually you'll see a child psychologist, again, for behavior problems, separation, maybe the parents are going through a divorce, and different kinds of things like that. Pediatric psychology is synonymous to what we would refer to as health psychology for adults, which is really focused on the research side, things like stress mechanisms, how the brain and the body connect as it relates to disease and illness and so forth. And so that applies to childhood and pediatric psychology. So it's psychologists who study, specialize, work with, and understand the interaction between health, the body, illness, and the brain, the mind, and our overall psychological well-being. And so in a clinical sense, you'll see a lot of pediatric psychologists work on things like medication adherence, needle phobias, doctor phobia, pain management, stress management as it relates to medical intervention, and so forth. In terms of how that kind of relates to my work in autism, it's something that I was interested in really early on. Back to that, some of those first jobs I had, one of the things I noticed was that a lot of our children were ill. They had a lot of complex conditions. Many of them vomited regularly, had diarrhea often, would have seizures regularly during the day. Many of them needed medications and complex care management. And I ended up doing my dissertation research on GI disorders. And so I think as we start to understand all the different contributing systems, it starts to, again, bring back this idea of holistic treatment and understanding. And I started to wonder, is it really that the autism is maybe causing these medical problems, or is it that these medical problems are related to autism? Is there some kind of bidirectional relationship? And so that's where I think this overlap of pediatric psychology and autism research has really come in for me. And in specifically looking at things like GI disorders, I've done some research around obesity and weight-related challenges, sleep disorders, and how all of those, of course, impact broader functioning. And so pediatric psychology for me, specifically applied to neurodevelopmental disorders, has really been around untangling some of those intricacies.
And could you also talk about the integration between genetic, neurological, and behavioral data in your studies and the challenges you face in this process?
Yeah, for sure. Well, for me, one of the challenges is setting to an extent. I am very fortunate to be at what we would call a more teaching-heavy institution, and so I get a little less time to do research. And more of my time is spent teaching, which is fun. I really like that. What that means, though, is that it's harder for me to get larger samples, integrate larger sets of data. But I do think that even will hold true sometimes at larger, I was trained at larger research centers, at hospital-based grant-funded research centers and things. And even so, when you're trying to look at behavioral presentation or genotype and phenotype. Genotype, of course, is our genetic makeup, the inside, and then our phenotype is the expression of that. So it could be physical features, behavioral, psychological. And I think in order to really do this good comprehensive research, you need to be able to look at, or at least, when we're talking genetic disorders alongside neurodevelopmental disorders, you have to be able to look at the genotype as well as the phenotype. And so sometimes those challenges of gathering multidisciplinary data even hold true across your larger research centers, because you're having to have families come in for a long period of time to go through extensive psychological and behavioral testing. And then they might need to get blood draws or cheek swabs or things to gather genetic data. And a lot of times it'll require multiple visits if you're talking longitudinal studies or treatment-based studies. And so attrition becomes a problem, having people drop out, they're unable to come back. The long-term commitment of participation in research can be a challenge. And so those are just some of the things that I think we tend to face from a practical perspective. We also realize it is a lot for families to participate in research. Sometimes it's travel, sometimes it's a whole day off from work and school and so forth. Sometimes they're compensated and sometimes not. It's usually not a ton monetarily either way. So there are some logistical challenges that I think are out there, but we're getting better at trying to straddle them, I think.
And what specific health-related findings have you identified in your research, and how do they contribute to early diagnosis and personalized treatment plans for individuals on the spectrum?
So my research, like I said, I'm really interested in health-related challenges and their overlap and interplay as it relates to autism. And so one of the things that I'm interested in looking at is the correlation between subsets of behavioral presentation as well as GI functioning, for example. We know that there are many emerging hypotheses and things coming out related to, like I mentioned, the gut and different parts of the brain, for example. But our basis of understanding and diagnosing autism is still purely behavioral. It's still purely based on observation and clinical judgment. There is no blood test, there's no brain scan. And so my work has been around understanding how these behavioral clusters then, or these behavioral presentations, correlate to gastrointestinal functioning, dysfunction, and so forth. And what I found early on was that difficulties with socialization, communicating with others, was correlated to more problems with GI functioning. That was replicated, and difficulties with communication are also highly correlated to challenges with sleep. And so I think a lot of times how this translates to care and practice, I think your question was, how it can help lead to diagnosis and personalized treatment. Back to this idea of a holistic approach, we really need to look at, and this is something that I speak often about when behavioral providers, psychologists go in, we're normally just looking at the specific behaviors that maybe we want to work on a behavior plan. But I think it's really important to look in the broader context. Is this a healthy child? Is this a child that's sleeping? Is this a child that's eating? Is this a child that's getting, their basic needs met? And how can we help meet those needs as well? So sometimes it's about looking at how we can use our science across the whole child. And that might be sleep-based intervention, feeding-based interventions, things like that, to help support the child or whomever it might be across their age span.
Okay, yeah, that makes a lot of sense. And how do you measure the efficacy of all these interventions? Are there any metrics that are used or you like to use to track progress in individuals taking a treatment?
Yeah, that's a really loaded question. It's a good one. And I think, it's an important question, because it's something that I think as a science, we have struggled with in different ways. On the one hand, behavioral science does a really good job at being very data-based and very observable. And we have usually what are called single subject studies that are very well controlled and, one participant with lots of observable data. The problem is that while that does translate well into clinical practice, if you're doing behavior analytic work, we're seeing more and more autistic people coming into just traditional therapy settings, wanting, especially as they get older, right, moving into adolescence, adulthood, wanting to come in and just seek traditional therapy. And that is a setting where I think we've sometimes struggled with being good at evaluating outcomes. One of the things that is important, and I think we've done a lot of good work, is stop looking at objectifying just the behaviors and getting better measures of happiness, adjustment, and belonging. What I mean by that is back to that behavioral work earlier. Normally we're looking at, well, is the child stimming? Let's reduce that stimming because it looks awkward. So we're going to take data on the stimming all day and put interventions to reduce that. And that's how we'll measure progress. The problem with that is the stimming wasn't bothering anybody. And now, the child kind of seems unhappy or something else. Was that really a good measure? Was that really a good metric for us to go by? And so I think one thing that I really advocate for in my practice and with other folks is to look at broader metrics of progress. And that doesn't always have to mean what we determine progress looks like, but taking a more, just a broader approach to that, I think is important. And I think it's something that we've seen start to progress in our treatment a little bit more lately.
Could you share a few examples of how your research has directly improved clinical practices or intervention strategies in the field of autism?
Yeah, I don't know that my research personally has directly improved clinical practice so much. I hope that it will, and it starts to. But what I do think, again, back to looking at some of the correlations between diagnostic features, behavioral features, and behavioral problems, drawing an awareness to how, one of the earliest things that I often thought about was, as I mentioned, I saw a lot of children with diarrhea. I know it's kind of gross. And that ended up being what my dissertation research, as I mentioned, was on, because I saw it so often where children couldn't or didn't communicate that they needed to go to the bathroom, or weren't able to recognize the signals that they needed to. And so then we had children who, became constipated and all kinds of other challenges. And so I think in terms of directly improving practice and intervention, looking at how we can actually back to the question of looking at outcomes, progress measures, it's not just about changing that day-to-day behavior, but are we changing the child's life in general for the better? And so if we improve their communication, if we can actually get them on a toileting schedule, if we can get them to communicate and identify the signs in their body when they have to go, and then communicate that to somebody else and teach them a routine so that they can toilet independently, can we then look at, are the GI problems starting to resolve a little bit? Are they starting to gain their appetite back? Things like that. That to me seems to be also a much better indicator of progress, then can they just hand you this toilet card on a schedule or something? And so that's, I think, just one example or one way that I really try to promote the integration of this work and these findings into a personalized treatment and personalized outcome measures, being able to actually, again, look at the whole child, look at the holistic components and see what's going to move the margin there.
I also wanted to ask about like kind of the tools or platforms, like the technological tools or platforms or innovative therapies that you use in your practice and kind of how they impact treatment outcomes.
Yeah, it's a good question. We know that technology is super rapidly advancing. I think one of the, if there was any good things about the pandemic, it helped us realize that we can do a lot of things in different ways using technology remotely and so forth. And so lots of people are seeking those kinds of interventions for convenience, for financial factors, a whole range of different things, transportation issues and whatnot. And so that's actually something that lots of folks in my field have been working around to develop more streamlined and better practices to be able to deliver these interventions via technology. And by that, I just mean basic telehealth at times. And so I've been able to work with a lot of parents and families in a coaching-based model. And sometimes it actually works nicely to be able to observe at home, because when I go to a school or when I go to a child's home, they see me. It's something that we call reactivity. So they're reactive to my presence, and they are entirely different, the parents will tell me, than on a regular day. So sometimes being able to actually observe them remotely through technology and having a small camera or something is really helpful. And I think that that's actually been really important and a really helpful development. And then again, people have done a lot of good research around the validity of these interventions. How effective are they? How sustainable are they? And we're continuing to see that unfold. And so that, you know, is not super advanced, but it's kind of a basic technology at this point that we have really been able to take and utilize. The other thing is there are some great apps out there for being able to communicate with families, have them be able to collect data, things like that, or just other information. By data, I might mean like in my work, a bowel movement, for example, how often the child is using the toilet, a sleep schedule, stuff like that. So sometimes there are also really good technology platforms that can help the parent and the child as you're working towards some common goal, especially around things, like I said, like toileting or feeding or sleeping.
Thank you. And I'm very curious, what are some of the most common misconceptions about autism that you encounter in your clinical practice? How do you address them? And do you think there's a general group that you see them coming from?
Well, so there are definitely a subset of misconceptions that have been around for a long time that are still around. One of which is the refrigerator mom, for example. So this idea that mothers of children with autism were cold and distant, and that's what caused autism. And so I still hear that every once in a while, or that, eating too much tuna during pregnancy or something. But there is all kinds of misconception or bits of truth that, a correlational study that then kind of gets turned into causation, which we know is a very slippery slope and dangerous in psychology and social science research. So a couple of those old ones have been around for a bit. And then, of course, there's a whole new wave of different misconceptions and things and I think you asked a good question, who they are coming from. I think it's not a surprise that we do see a lot of TikTok-based referrals, if you will. There was actually a study, forgive me, I don't recall the authors now, that came out earlier this year that showed that about, I want to say, forgive me, it's not an exact statistic, but about 60% of the information about autism on TikTok was wrong. But I will say it has it has, I think, really improved awareness. And yet people will come forward with misinformation, and it will help them open a gateway to something else. what I mean by that, for example, is they'll come in and say something like, I sleep in the fetal position and I always wear my hair the same way. So I've heard that that makes me autistic. Can you, or that could mean that I'm autistic. Can you do an evaluation? And so sometimes it's just some psychoeducation around how neither of those things are indicators of autism. However, if you wear your hair the same way every day and you can't tolerate it any other way and you have all kinds of other sensory problems and you know, we can go on from there, sure, then maybe. So I see a lot of things like that, kind of everyday behaviors that have been turned into characteristic features because people on the internet have said that they are. Like I said, sleeping in the fetal position is one of them. Wearing the hair the same way, and some of them are based in truth, right? So wanting to wear the same clothing every day because of the preference for texture, that could be an indicator for autism. But I think it's important to remember that no one thing on its own is ever meaningful. It usually needs to be part of a bigger set. And then in terms of who I see it coming from, surprisingly, the age range, I think, really varies. I do see a good group, a good chunk of people, I would say 20 to 30, 18 to 30 or so, and certainly some younger from there, that are more self-identifying, and self-diagnosis and self-identification is something that we've certainly been doing more research around, and how accurate that is or isn't. So there's a handful of things that are going around out there.
And are there any like projects or initiatives you are currently working on or are excited about that you believe have the potential to kind of revolutionize our understanding of how autism works?
Oh, I don't know about revolutionize, but I hope so. And well, one of the things that we've been doing for a long time is looking at autism as it relates to other disorders, other behavioral disorders and neurodevelopmental disorders, as well as genetic disorders. There is a large incidence of autism that occurs alongside a known genetic condition. And so the general basis of the genetic and autism research is that if we can learn to understand more about these different genotypes, these different genetic disorders that autism often co-occurs with, can we then better understand novel treatments for autism? Can we then better understand, you know, the general course of autism across multiple different domains? And so some of the work that I'm starting right now with my lab at the university is looking at the overlap in symptoms between something called a Chiari malformation, which has to do with the anatomical structure at the back of the skull, as it overlaps with autism and similar symptom sets. Much like I said, with many other genetic disorders, we're seeing greater incidences in these populations, and it's something that hasn't really been looked at yet. So I'm hoping that will be new and exciting research that can contribute to the bigger body that can then help revolutionize treatment, because the genome is really complex. There's many different genetic variants and presentations. And so I think the more that we can contribute to the broader body of research that helps us understand them, and look at that phenotype, that expression, as well as the genotype, the more that we can start to make moves there.
And can you speak briefly about how your work in forensic psychology kind of relates to and helps your expertise in neurodevelopmental disorders?
Yeah, forensic psych isn't something that I really got into until later. I'm not really a forensic psychologist by training, meaning that my friends that have been doing things like competency to stand trial evaluations and Miranda rights evals and all those complex legal criminal things. I don't do any of those. But what I am asked to do is consult or serve as an expert witness or provide an opinion on somebody with a neurodevelopmental condition like autism that is involved in some kind of litigation. Most recently, I've done mainly civil cases. And so somebody who is being sued, for example, and that is a relevant factor. But I have colleagues who do this in criminal work as well. I was reading over a case briefing where an individual was charged with stalking an autistic individual who was very, very well intentioned and very sweet and wanted to go on a date. But their social delivery was less acceptable to the person on the receiving end. And so the psychologist had to help the court understand that this was a person with a neurodevelopmental condition that really at its core affects social functioning, affects social interaction and communication. And while it doesn't make necessarily the person who felt threatened, it doesn't make that okay, it is something that the court should consider, right? We don't want to punish this person perhaps in the same way that you might somebody absent of such a condition. And that maybe depends on how you philosophically feel about punishment and the judicial system and rehabilitation. But the job nonetheless will come in at what we call mitigating circumstances. So it will usually impact the sentencing. So rather than, time, it might be rehabilitation and intervention. And so I think people who have this expertise, who can get out there and again advocate in different settings, is really important.
Yeah, I think that's a very important kind of thing to do because misconceptions are so common like that. Even I think at the court level, maybe some people like you said just now, it's not okay to kind of follow someone around, but we need to understand that it's not like it's not coming from a place of kind of, I guess, creepiness that people associate with that kind of behavior. And what advice would you give to new researchers entering the field of autism, especially regarding the integration of multidisciplinary approaches like you have?
I think stay curious. It's a really exciting field. There's a lot going on. As I said, autism as a disorder is still in its infancy in a lot of ways. It wasn't really documented until the 40s and 50s. And we have many, many people who are still alive that were born in the 40s and 50s. And so, we really are still in the first generation of this. We don't have a ton of geriatric autism research, for example. And so stay curious. It's a really exciting time to be here. Get to work with and learn from and meet as many different people and professions as you can. Obviously, as a psychologist, I trained with lots of psychologists, but I was very fortunate to get to work with psychiatrists and geneticists and neurologists. And I think being able to put yourself or try to get yourself in settings where you can get that multidisciplinary exposure, be able to consult with people of different trained expertise, but they still have the same interest as you, is really important.
Dr. Voulgarakis, thank you so much for this wonderful conversation, sharing all this amazing knowledge. Congratulations on all that you do. Thank you very much.
Thanks so much for having me.